A seizure is a brief, disruptive discharge of electrical impulses in the brain. It may involve the whole brain or just part of it.
So anything the brain can do, people have to realize it can also do in the form of a seizure. That's why seizures can appear in so very many different forms. Seizures can be staring. Seizures can be movement. Seizures can be just a funny feeling in your hand. Seizures can also be the generalized tonic-clonic grand mal convulsions that people tend to think of.
Absence seizures are brief lapses in awareness that begin and end abruptly.
I'm with you now. Go.
This girl is having an absence seizure.
Sabrina, talk to me.
What? I'm fine. I always tell my mother this. I'm fine.
In an absence seizure, generally the concept is that they're disconnected for a few moments. They're very likely to pick up exactly where they left off, but generally speaking, they do not know what is happening in that 3, 4, 5 second period of time.
This girl also has absence seizures, and you will see her have one as she's talking.
They take back that statement, because he can be as heavy as ever.
And there's a real blankness, a vacant look in the eye, and then all of a sudden they're right back with you and able to engage.
Sorry? Absence seizures usually require no first aid. However, they should be reported if seen for the first time. This young man is having a complex partial seizure, and his consciousness is impaired. These seizures are the most common form of epilepsy in teenagers and adults.
You want me to call him like we usually do?
Kevin? 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 Can you hear me? Can you hear me?
Complex partial seizures may create a variety of automatic movements or behaviors, such as this young woman is having. She cannot control these movements, nor is she aware of them. The movements of her hands are automatic. They look like deliberate movements, but they're not. They're part of the seizure. Her awareness of her surroundings is clouded.
They may seem to be sort of vacant, staring away, and then they begin moving around, perhaps picking at clothes, wandering rather vacantly, sometimes pushing people away because they're essentially in a rather confused kind of a state.
Complex partial seizures last only a minute or two, though the teenager may feel confused for a while afterward. It's easy to mistake them for behavior problems. If restrained abruptly, the adolescent may strike out in a reflex action, which may look like fighting. The seizures most people think of when they hear the word epilepsy are generalized tonic-clonic seizures, often called grand mal. They affect the whole brain and the entire body. The tonic phase is the stiffening of the muscles. Then the jerking movements begin, the clonic activity that you see here. Tonic-clonic seizures rarely last more than a few minutes. A person having one isn't conscious and won't remember what happened. The skin may become pale. Breathing may seem shallow and labored. Sometimes a teenager may lose bladder or bowel control or vomit as the seizure ends. These seizures may look painful or even life-threatening, but they're not. They end naturally after a minute or two.